Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about the differences between conventional medicine and functional medicine. Conventional medicine looks to treat symptoms and specific diseases with medications, radiation, and performing surgeries. Conventional medicine has a much more reactive approach where it's focused on diagnosing and treating the disease or condition once the symptoms are present. Conventional medicine is extremely good with acute care medicine, like if I have an infection or sepsis, have a heart attack, stroke, get in a car accident, break my arm. We live in the best country in the world for acute care medicine. But conventional medicine really struggles with chronic disease. Conventional medicine also compartmentalizes the body. If you have a skin issue, you typically go see the dermatologist. If you're having recurrent headaches, you typically go see the neurologist. If you're having digestive issues, you typically see the gastroenterologist. If you have thyroid issues, you usually see the endocrinologist, and so on. However, the body is not compartmentalized, and all systems of the body impact and affect each other. Functional medicine looks at several different factors such as diet, lifestyle, genetics, nutritional supplementation, with the goal to get at the root cause of disease and symptoms. Functional medicine is much more proactive with its approach and looks at the body as a whole. Functional medicine's primary objective is to answer the question why. Why are you so tired all the time? Why do you wake up in the middle of the night and you can't fall back asleep? Why do you get constipated? Why does your energy crash in the early to mid-afternoon? Why are you getting frequent headaches? If you can answer the question why, then you can get at the root cause of your symptoms. Whereas in conventional medicine, you'll typically be prescribed a medication instead of investigating why you're having that symptom. So what are the testing differences between conventional medicine and functional medicine? Conventional medicine will primarily use imaging like MRIs, X-rays, CT scans, ultrasounds, endoscopies, colonoscopies, and more, along with standard lab testing like traditional blood work, urinalysis, stool testing, to help diagnose certain diseases and conditions. Whereas in functional medicine, we use a wide variety of testing along with taking a comprehensive history to assess imbalances or dysfunction within the body. So what testing do we look at Restorative Health Solutions to help get to the root cause of your symptoms? We look at food testing with food allergy testing, food sensitivity testing, and we test for genetic predisposition for gluten sensitivity. We look at stool and organic acid testing to rule out any imbalance of the microbiome or subclinical infections. We look at toxicity testing to rule out mold toxicity, heavy metal toxicity, maybe toxicity from insecticides, pesticides, herbicides, cleaning products, and more. We look at nutritional deficiencies. We look at cortisol and adrenal function. We look for hormonal imbalances between our sex hormones like estrogen, progesterone, testosterone, along with thyroid hormones. We look at red blood cell health and rule out anemia. And we make sure that we rule out any blood sugar imbalances. Once we get the test results back, we then put together an individualized diet plan, suggest lifestyle modifications if necessary, suggest stress management strategies if necessary, and also suggest specific nutritional supplementation based off of history, symptoms, and test results. So what's the difference between conventional medicine and functional medicine when it comes to patient engagement? This is one of the biggest frustrations we hear from our patients frequently. In conventional medicine, the patient usually only gets 5 to 10 minutes of the doctor's time and is usually left with a prescription or a referral. The doctor simply doesn't have enough time to answer all the patient's questions, and they're usually left with something like, oh, you're really healthy, all your test results are normal, it must be stress or genetics, or you're just getting older, but yet the patient still has symptoms and does not feel well. In functional medicine, the patient or client gets much more time with the practitioner to go through their history thoroughly, to get all their questions answered, to get specific testing recommendations for them and only them, and to put together a personalized plan. At Restorative Health Solutions, the average new patient consult is 60 to 90 minutes long for this reason. So are there any potential downsides to functional medicine? The main downside that everybody talks about with functional medicine is that it's not typically covered by insurance and is an out-of-pocket expense. However, HSA and FSA plans are typically covered for all appointments and testing. And lastly, when does one consider coming to a functional medicine clinic? The most common scenario we see at Restorative Health Solutions is when the patient has done everything they possibly can through conventional medicine and they're left with very little answers and they still have symptoms and don't feel well. Again, conventional medicine is very effective for acute conditions and illnesses, but not as effective for patients struggling from chronic disease and symptoms. At Restorative Health Solutions, almost all of our patients come to us with chronic symptoms or conditions and not because of recent onset symptoms. Well, I hope you learned a little bit today about the differences between conventional medicine and functional medicine, and until next time, I'm Dr. Paul.